Hello, my name is Rose Tran. This is Evidence-Based Practice Project, Primary Prevention in Cervical Cancers and Human Papillomavirus. I will be using a short-term abbreviation, University of Kentucky College of Nursing, NUR 463201, Nursing Clinical Practical Capstone. I am a registered nurse, worked in about a year and a half. I recently currently working in the surgical ICU, CVICU, and medical ICU. I am not working in Kentucky, but outside of the state for my practice. So I will go ahead and go to the next slide. So this is the practice setting where I have been pretty much been learning the research with the preceptor that I'm working with, who focus on cervical cancers and human papillomavirus, HPV, of focusing on a public health setting. And what she focused on the target population is pretty much age of 25 to 35, and they are among of African American and Sub-Saharan African immigrants, female patients. I did completed my 40 hours of clinical capstones outside of my working of my environment, and I did a research with the preceptor focusing on contact analysts, where this is about the open-ended survey questions, where I be taking the participants who did the questionnaires of the 6 questions and break it down into coding scheme, where the coding schemes has all the participants' answers and put them into subcategories, where it becomes into 3 themes, where the 3 themes is all about the having to learn about the best practice, what we can do to do improvements of their care, of the awareness, and able to do better of improving of education. So usually we would be doing a meeting weekly whenever we are available as with the preceptor. And her credential is BSN, PhD, APRN nurse. She is a assistant professor working currently in the University of Kentucky of Nursing. She did a research continue on with the screening of cervical cancers and HPV for about 2 to 3 years. She's been funded by the American Society of Cancer Foundation, and she's been doing this, published in journal of the articles about the cervical cancers and HPV screening. So the learning objectives I have done for that will be taken from the practice settings of the 3 main goals are, as first is the learning goal of assessing and perform and screening of the patients of among with the African American and Sub-Saharan African immigrants assessment among the female patients. And the second goal is to do the generate a plan to educate the nursing staff on primary preventions of HPV and cervical cancers in the African Americans and Sub-Saharan African immigrants of female patient. And third goal is to identify the way to implement the nurse-driven interventions that provide educational knowledge and address concerns among African Americans and Sub-Saharan African immigrants of female patients. And there are ways to achieve this goal. Is just to always educate the patient and let them know about the awareness of the symptoms, and just to prevent any further happening in the future of having a HPV and cervical cancer. And this is why, as being a nurse, it's important to always teach them, let them know about it, and show them that you're not alone, but we're there to help them and guide them way to prevent any further having one. So this is about practicum experience versus literature. So it's about where I be talking about the practicum experience of the education versus the other facility education up from the literature that talks about the prevention of HPV and cervical cancers of African Americans and Sub-Saharan African immigrants. What I learned about the practicum experience with the patients that was talking on the survey with their education, they were not able to get a lot of access coming from it, where they mentioned that they have to know the stuff coming from the internet or social media or just going through talking with the family members and everything because it's kind of hard for them to go to the clinic or go to see their doctor because financial or not having insurance to cover to do a visit checkup versus the literature where they said that the African Americans and sub-Saharan African immigrants have trouble trying to get themselves at some educations by transportation's been pretty much a lack of source for them to try to go visit or have appointments. So those are just the things that shown that they were not able to get any good ways to learn about the awareness of HPV and cervical cancer. But with the communication barriers of having for the African Americans and sub-Saharan African immigrants, what I learned from the practical experience from the survey is that they did not been able to get any word or things they can learn from going to see a doctor or seeing a nurse to talk about the surgical cervical cancers and HPV is because most of the time the healthcare staff just don't have ways to teach them, or they're just too busy, or the fact that it could be that their skin color makes it really hard that they're not able to get a lot more information compared to being the color of the different skin. So that's what I learned what they said on the survey, where it's very difficult when you don't get a lot of information compared to another different color skin. Compared to what the literature said of the communication barriers between with the staffing is that they would probably would have to make sure to have a face-to-face interview with this nursing staff and see what they can do to do a better effective communication to help them learn better and show what can improve to do a better care of showing the patients what to prevent of having cervical cancer or HPV by just doing more relearning of all these stuff. What the literature is trying to do is to re-educate the staffing about for communication barrier. So what I noticed that the practicum experience talked about the recommendation is that they said that it's usually recommended for screening is 25 to 35 compared to what the literature said, it's 27 age through 45 for the recommendation for the screening of HPV and cervical cancer. So with the best practice and changes, I did highlight the three things is about more of learning of getting education and resources where there's been pretty much been limited of getting education and resources around the area, especially if they're living in like rural or just pretty much financial issues living in small towns have trouble finding ways to learn about how to prevent or awareness about cervical cancer or HPV because there's not a lot of having a health clinic or hospitals around in that area. So it would be nice to have a little bit of changes where we as a nurse or healthcare professionals can probably go down to rural areas or small towns to do a health fair and just provide them some screening or do a learning about education about the vaccines that can help further having a HPV or cervical cancer. And the second thing to highlight is about just trying to give awareness, not just only African Americans and sub-Saharan African immigrants, and but just like all diversities and all genders, not just females, but males as well. It seemed like the whole society's been too focused on thinking that it's just the 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 high prevalence has to be just a diversity of just ethnicity color instead of just talking about all generals instead, because it seemed like not only because the African American and Sub-Saharan immigrants are the highest risk of getting cervical cancers and HPV, but it would be great to at least show some statistics that not only they are having some high risk, but so is others of like Asians and of other like Hispanics and just from like other countries as well to be having those awareness would be nice because it would show that if we can bring more information to all different ethnicity and genders, that it'll help to give awareness all around the community areas to grow stronger, and that it'll help prevent further having to be getting cervical cancers or HPV. And the last one is just talking about how we can just do a better communications among the healthcare professionals and the patient is just try to maybe just re-educate the healthcare nurses and staffing because sometimes it's hard that we as a nurse not able to get to learn about what we're supposed to tell the patients of awareness or what symptoms to watch out. It'd be good that we do a little more relearning or just education, especially if you're on training or doing orientations. They should just bring up a little more information to help us do better job at teaching the patients so that they can be aware of what we can help them to look out for and what to get some screening check or schedule one and maybe just show them what's the best way to change lifestyle if they were to be just to prevent having a cervical cancer or HPV. Overall, with the reflection I learned from the whole experience of researching with my preceptor is that it's been a very good perspective learning of just knowing how to watch out with especially with cancers of HPV or cervical cancers, and just learning of telling the patients about what you can do as a nurse to teach them better and show them, there are ways to help prevent having it to, further away from getting one. So just being, an ICU nurse, learning from all this experience of research helped me learn a lot that, not just because I learned about taking care of the sick patient, but even the healthy ones too. So this whole reflection helped me learn a lot to grow so I can continue on throughout my career to learn about it and understand how, we as a nurse can provide better care for our patients not just because, they're sick, but even healthy too. So I do want to thank Assistant Professor Abula for allowing me to be part of her research and learning about all this interesting research about the cancer. And I just appreciate it. Thank you. And this is the reference I use from the literature. Thank you.